under this law, the share of Americans with insurance is up.
Americans were promised lower health care costs.
But the first order of business.
We're going to repeal it and replace it.
Obamacare will be gone.
Obamacare is a complete and total disaster.
I bet you're sick. Not with some deadly disease. I mean, you're probably sick of the endless talk about Obamacare. Yet the debate over healthcare started way before Obama was even born. Doctors, politicians, worker unions have been arguing forever. Should it be limited, covering some? Or should it be universal, covering everyone? Should it be mandatory or optional? Should private companies provide it or the government? The debate over health coverage has been going on and on for almost 100 years. Sometimes slowing down, and other times moving faster. And it's still not settled. In the early 1900s, health insurance was barely alive. 90% of Americans didn't have it, and they didn't even care. They had other things to worry about. Wages and pensions, for starters. Medicine had only been around for 40 years or so. Doctors didn't actually know that much about bacteria or diseases. X-rays weren't common, and neither were blood pressure tests. Surgery was very basic. Doctors mostly made house calls, and patients paid them small fees out of pocket. By 1910, the heart of America's healthcare was beating faster, spurred by medical advancements abroad. Germany, for starters, was providing healthcare to its citizens. And so it inspired a progressive labor group, supported by former President Theodore Roosevelt, to campaign for the nation's first healthcare bill in 1912. But World War I messed things up. Germany became the enemy, and anything considered the least bit German was anathema, including healthcare. I mean, this is a time when Americans actually renamed sauerkraut so they wouldn't have to say a German word. The healthcare bill was dead. By the 1930s, the desire for healthcare was growing again, and so was the number of Americans who thought the government should provide it, 80% to be exact. Then boom, the Great Depression hit. Businesses collapsed, people lost their jobs, and as a result, their health benefits. The number of uninsured soared to almost 100%. We must do something, America screamed. Well, President Franklin Roosevelt came to the rescue with a universal healthcare proposal as part of his New Deal. But Congress hated it. With millions out of work, rebuilding the economy was FDR's top priority. So he dropped the healthcare plan to avoid jeopardizing his vision for recovery. Meanwhile, a capitalism-friendly alternative was gaining traction: private healthcare provided by employers. Between 1940 and 1960, the number of people insured through their employers skyrocketed from 20 to 70%. It was the golden era of healthcare. So when Harry Truman made a new attempt to introduce a universal healthcare plan in 1948, it was met with resistance. By this time, doctors were making big bucks through private insurance, and they didn't want the government to interfere. The American Medical Association, also known as the AMA, the nation's largest association of physicians, sprang into action and bankrolled the most sophisticated and expensive PR campaign the country had ever seen. Among other things, the AMA placed ads in newspapers across the country to tap into the Cold War fears of Americans. The United States under communism, freedom under attack. The voluntary way is the right way. Soon, Americans were convinced that government-sponsored healthcare is an evil communist plot. And they freaked, especially people with health insurance, because they didn't want to lose it. Actor turned politician and son-in-law of a prominent AMA neurosurgeon, Ronald Reagan. He sealed the deal with what became known as Operation Coffee Cup. The future president sent a special message to the wives of AMA members and asked them to share it at their next coffee klatch. He called it Ronald Reagan Speaks Out Against Socialized Medicine. Catchy, huh?
My name is Ronald Reagan. One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. This threat is with us, and at the moment is more imminent.
Now properly schooled in the evils of socialized medicine, women were encouraged to send letters to their elected officials. The campaign worked. Universal healthcare became a third rail no one wanted to touch, and so its heartbeat grew weaker and weaker and weaker. For the next 30 years, Republicans and Democrats alike tried to revive it, but failed.
We are behind every country pretty nearly in Europe in this matter of medical care for our citizens.
We must reform our health care system.
This card will give comprehensive coverage.
It's time to bring about fundamental change, control our nation's soaring healthcare costs.
I am not the first president to take up this cause, but I am determined to be the last.
So, after a lot of drama, Congress passed the Affordable Care Act, or Obamacare, the first national law enacted to ensure that all Americans have access to affordable health insurance.
We are done.
It only took 100 years, people. But, as you probably know, its survival, even as a law, is still touch and go. Will it be repealed? Will it be replaced? Will it be the gateway through which America becomes a socialist nation? Who knows? So, one thing is for sure. The Affordable Care Act is the law of the land, for now, and it's providing 20 million people with health coverage. How are you feeling? Good. Feel better?